Hello, this is Bob Reiner, starting with a three-part series on improving Nebraska health care. Part one is where's the accountability in healthcare from the perspective of an employer? And so by accountability, I'm basically using, am I getting what I'm paying for if I were an employer buying healthcare? One way to look at it kind of most simply is what we pay as a group versus what we get, and then who's in the middle establishing that accountability. In this case, let's say if I'm a large employer and I use a health insurance company, how do I know that I'm getting what I pay for? And I'm going to use Lincoln Public Schools as an example for a couple of reasons. One, I'm on the school board, and this is actually something we're looking at right now. And some of this information is public, so we can kind of get some examples of this. So, for example, if you go to the LPS board website, you'll see that on our consent agenda how much we spend on healthcare. So there at the bottom is our check to Blue Cross Blue Shield for April, and then a little over $7 million. And if you do the math, well, that means what we pay as Lincoln Public Schools is almost $85 million a year for health insurance, but also there's the out-of-pocket health care costs, which are probably somewhere in the range of $10 to $20 million. I don't have access to that data even as a school board member, but that's something we probably ought to work on is how much is we're paying for out-of-pocket. And then what we get on the other end is we get health care for our employer, spouses, and kids. But what are we getting? Well, in our case, at Lincoln Public Schools, we use an association plan with most of the other school districts in Nebraska called Educators Health Alliance. They use Blue Cross Blue Shield as their payer, and they do have some preferred networks underneath. But what data do we get? And the answer is right now very little to know that we actually get what we pay for. So that's what we're working on, and that's why we use an example of what's out there versus what could be. So for when it comes to accountability, another thing you should be aware of is something called accountable care organization. These have been out for about 15 years now, and this is for 12 of my prior years. I worked as a chief medical officer of accountable care organizations in Nebraska, and what those are, it's a group of healthcare providers that contract with Medicare or health insurance companies or Medicaid managed care plans. They make a contract where they agree to provide a target level quality of healthcare at a specific price target. So to me, that's accountability. If they meet and exceed those quality and cost targets, then they share in the savings. So, for example, in Lincoln Public Schools, say we spend about $100 million, they could potentially contract with the Accountable Care Organization, and if instead of $100 million, it came out at $95 million, what they would do is agree to share the savings. So the Accountable Care Organization would get $2.5 million, and the employer would get $2.5 million, and/or the employees themselves. To me, that's a win-win-win because everybody did just better. We have healthier people, and it costs less money. So who wouldn't be happy with an arrangement like that? And the answer is, well, hopefully everybody. And these are pretty prevalent in Nebraska. There are actually Medicare, like I say, has been out. They started their Medicare ACO programs in 2012, so they've been out there 13 plus years. Here's their press release from October 2024 for the 23 contract year, where they saved $2 billion, largest savings in history. And so the Medicare ACO program keeps getting better and better, and more studies keep coming out about this. So why don't you know more about this? Unfortunately, most employers in Nebraska know very little about this because the health insurance companies and brokers haven't been telling them much about it. It's baffling to me because Nebraska has multiple ACOs that have been very successful for, like I say, for more than 12 years. They've had contracts with both Medicare and Blue Cross Blue Shield. I know because I was on the other side contracting with Medicare and Blue Cross for the prior 12 years. Majority of Nebraskans are actually taken care of by these ACOs on Medicare and for Blue Cross Blue Shield. And I've been actually putting summaries of the Medicare contracts out for quite a few years now. This is our website where I work, healthynebraska.org, where on our Align page, so if you go to our website, click on what we do, click on Align Nebraska project, you can see the last 10 years worth of summaries from Medicare. So this is not a new thing, and the ACOs have been very successful for quite a number of years in Nebraska. If you go to page 2 of the last update we've put, here's what it looks like. So this is a busy slide. So let's use example here in Lincoln, Nebraska. Where do you get health care in Lincoln, Nebraska? Well, there's 3 big physician networks that take care of people. One Health Nebraska ACO, where I used to work, that has the biggest portion. That's about 50 to 55% of the primary care physicians in Lincoln would be a part of this contract. Bryan Health Connect, you're probably familiar with Bryan. That's probably, I'm going to guess, 20 to 25% of primary care. CHI Health Partners or St. Elizabeth, that's another 10 to 15%. You add those 3 together, that's more than 90% of Lincolnites are taken care of by these 3 these 3 networks. And actually, for all 3, their care is pretty good. So let's talk about what these things mean. So a light green square, that means they're better than average for ACOs across the country, which are already better than average compared to the rest of the healthcare. A medium green like this square is better than the 75th percentile. A dark green square like this one is better than 90th 90% of the ACOs across the country. So really, really good care. So the good news is Nebraska, more than half of Nebraskans are cared for by these 7 entities, and you'll see a lot of green here. And it's broken into buckets, so cost and utilization, so savings rate, here in Lincoln between 6 and 9% savings on the Medicare contracts, so you got great care in Nebraska in all 3 entities, honestly. High quality scores, which is what this next category is. Here's your chances of being in the hospital or the emergency room, all 3 above average, some quite a bit more. Also customer satisfaction numbers, like getting timely access to care, how long I have to wait, are you going to be getting access to specialists, did people treat me well, so good customer satisfaction. And then quality outcomes, everything from being well-controlled blood pressure, good control of diabetes, treatment of depression, colon and breast cancer screening, the whole things, all things that you should care about as a patient or as an employer. So for Medicare, there's really good accountability out there, and it's been getting better year after year. So if I were on the board of Lincoln Public Schools, which I am, I would want something like this to verify that for that $95 to $105 million we're spending on healthcare each year for all those employees, spouses, and kids, are we getting what we pay for? Right now, we don't get any of that information. So for me, I would want something like this, and I also not just want it for our plan. I want to know for each of the networks we contract with, because before we offer a preferred network to our employers, I want to make sure that that network is something they actually want to contract with, and they need a justification for why they should be preferred, and it should have something to do with the quality of care they provide. And it's not just Medicare and Blue Cross, so this is actually a Medicaid report, which you can find on the Nebraska Medicaid website. Nebraska, the state, actually does similar reports for its managed care companies. So if you look here, UHC, that's United Healthcare Community Plan, NTC, that's Nebraska Total Care. Molina's not on here because 2023 was their first year, and they got a pass on quality reporting for the first year. But it's some of the same stuff, timeliness of prenatal care, childhood vaccinations, well child checks, blood pressure, a whole gamut of things. So this is the kind of accountability is becoming routine in healthcare, and employers should be asking for the same, because if Medicaid and Medicare can do it, commercial can do it too. There's also been a group in Nebraska called Align Nebraska, where a bunch of us, including me and Ali Khan from the College of Public Health and the chief medical officers of multiple ACOs and insurance companies, we've been putting together a list of quality measures that we think everybody should be getting in Nebraska. You'll notice a lot of the same measures we've just talked about in the Blue Cross, Medicaid, and Medicare. So I think any employer should be asking for this now. If you're a large employer, you want to know that you're getting what you're paid for. And so these are the measures you should be asking for to make sure that you're getting the health care you're paying for. Now, why each of these measures is important, each of these has very strong reasons for it. And I'll start with blood pressure control as number one. So why would you want to know blood pressure control? Well, this is the last NHANES report. NHANES stands for the National Health and Nutrition Examination Survey. It's a nationwide survey where they study the prevalence of diseases like high blood pressure, for example. In the United States right now, for people over 40, which is the dark and light green bars, more than half of people have high blood pressure. It is the most common chronic disease. On top of that, it's actually very inexpensive to treat. You can be on 2 and 3 good blood pressure medicines for less than $20 a month. So there's no excuse for not having good blood pressure control. And you want that because high blood pressure leads to so many other diseases. It leads to heart disease, strokes, kidney failure. It's often referred to as the silent killer because sometimes the first time you find out you have it is after you've already had your heart attack, which is far too late, of course. So this is something you should be asking for if you're in your health plan, because this is probably one of the most important things for you to track. Partly it's for the lives of your employees. So, for example, this is an American Journal of Preventive Medicine summary where they went through many quality initiatives and which would save the most lives. And although, vaccinations and colon cancer screening and mammography can save lives, nothing comes even close to blood pressure control. And it saves a lot of money in the long run because the cheapest heart attack is the one that doesn't happen. Here's a more recent article from California where they're projecting the California Marketplace Plan lives saved for colon and blood pressure control and extrapolating to the entire country based on payer status, and you could save 3 times as many people with blood pressure as colon cancer. So blood pressure control should be your number one measure you're focusing on. But also there's pediatric measures. So vaccinations, for example, are an important thing to be studying. I'll start with HPV vaccination as an example. So the good news is that cervical cancer mortality has been dropping in women for decades, and it was on a nice trajectory that thankfully was going down, but then it started going down a lot more in the last 10 to 15 years, and that's because HPV vaccination came out here. And as we got more women and boys vaccinated for HPV, we started seeing an additional drop in cervical cancer mortality. Really important, of course. Some even more recent data came out just in February this year that in a cohort that's been heavily vaccinated for HPV vaccine, there was an 80% drop in precancerous lesions. So that's also preventing procedures like colposcopies and bleeps and things like that. So this is a good thing. Not only does it save lives, it also saves money. Another example, measles vaccinations. We should be caring about that right now because we are in the midst of our first, what is likely to become a nationwide breakout of measles. The CDC and multiple states now have tracking systems, kind of like back in the COVID days, unfortunately. So here we go again for measles. So, for example, the big outbreak started in Gaines County, Texas, due to low vaccination rates. It's been spreading for months now with New Mexico, then Oklahoma, Kansas, Colorado, and then more recently Missouri. So it's on our way here. We want to make sure that our kids are vaccinated enough that we don't have to deal with this. It's not just because of the illness and potentially even hospitalizations and even deaths. It's also money. So a measles outbreak is expensive, and so here's a recent article. I've got a link to it that you can go look at it yourself, but essentially, basically, when they break down the costs, and you add up everything from the public health costs, like contact tracing and testing, the lost productivity, because an unvaccinated kid who's exposed has to sit at home for 3 weeks, which means mom and dad aren't at work, and the direct medical costs. Those hospitalizations and long-term complications are really expensive. They estimate about $47,000 per case, so that means the Texas outbreak has probably already cost up to $40 million, and those numbers are going to keep going up. And so if that's where we'd have an outbreak in Lincoln, well, who's paying for those? A lot of that? Well, it's all of us, taxpayers, businesses, everybody's paying those costs. And also things like prenatal care are important. I think this is one of the most important things that is not emphasized enough, because anything you do good in prenatal care can pay off as early as 9 months, because that's how long a pregnancy lasts. Nebraska, we've got a problem with that. So our infant mortality, and this is the state's dashboard where you can see that our infant mortality rates seem to be going back up again, unfortunately, which is too bad. The good news is we're not as bad as, say, Missouri or Mississippi, but we're not near as good as Colorado or New Jersey. And New Jersey's been making steady improvements because they have an active plan to do that. This isn't an accident that New Jersey got better. They've been actively working on it. We should do the same. In part way by making sure that everybody's getting adequate prenatal care. The good news is that most states, for people with private health insurance, or most of our counties, are above 80%, which is the Healthy People 2030 goals, but it could be a lot better. And unfortunately, Medicaid, a lot of our counties are below 80%. So we've got a lot of room to make up in prenatal care improvements in Nebraska. And so our employers should be part of this effort to make it all better. Because again, it's also not just the health of our babies, it's also money. So, for example, cost of infant mortality or infant morbidity, average cost of a NICU admission is $71,000, and we've had, given the 2023 numbers, that means Nebraska is spending close to $200 million a year on neonatal intensive care unit admissions. Wouldn't it be nice to avoid some of those costs in addition to making our kids healthier? And it's even a bigger issue because Nebraska, unfortunately, its trajectory when it comes to health is on the wrong trend. There was a time where Nebraska was in the top 5 in the country for healthiest states. Now we've been steadily dropping. We're down to 18 now, and so we'd like to reverse that slide. Where we've lost a lot of our ground is in childhood immunizations, most recently, for example. Again, back to the measles epidemic. So if you look at Nebraska's rankings and where we could be doing better, it's a lot of those same things I've just been talking about: HPV vaccinations, colon cancer screening, childhood immunizations, blood pressure control, all these very same things we're talking about. So this isn't just important for me as an employer for Lincoln Public Schools, it's important for the whole health of the state of Nebraska. So we should have every employee in Nebraska be asking for these quality measures to make sure that they're getting down. This would be the accountability to make sure you're actually getting what you paid for. So here's the end of part 1. I'll be releasing part 2 fairly soon. Part 2 will be why healthcare in the United States is so expensive in other countries, and part 3 is if I were an employer, what would be ultimate for me to ask for accountability, and that'll be part 3. All these links for those articles are all put here, and I'll also put them in the notes section so you can read more about each of these if you would like.